having 500,000 people unemployed is very unfortunate. And so I want to talk about how we're planning to move Virginia forward. I know everyone is eager to move forward. I know that I am. Yesterday, I extended the ban on elective surgeries through May the 1st and the closure of DMV offices through May the 11th. I took these steps because while we are working toward a time when we can ease some of these restrictions, we are not there yet. But we are moving in that direction. So today I want to outline how we will determine when we can ease restrictions and our blueprint for what that will look like. We have some slides. With our glitch in the technology, I'm not sure if all of you will be able to see those slides, and especially for the hearing impaired, we will have the words that describe these slides in full detail for you after our presentation. First, I want to talk about where we are today, and then we'll talk about where we're going tomorrow. Since the beginning of this situation, we have taken aggressive action. We closed schools, restricted businesses, and directed people to stay at home. We know that this work and the sacrifices of Virginians are delivering results. Together, we have slowed the spread of this virus. Our hospitals have not been overwhelmed, and according to at least one model, we may have seen our case count peak today. I hope that is true, but we must continue to work to keep counts low. We continue to watch the data. Our daily case numbers are still rising, as you can see from this chart, looking at the blue line on the top. But our growth rate is slowing. We see that our case count was initially doubling every 3 days, but now it is taking 9 days to double. That means the growth rate is slower. And hospitalizations rates remain flat. The yellow line at the top is total beds available. The orange line shows that those hospitalized with COVID-19 remains flat. The good news is that 1,600 patients with COVID-19 in Virginia have been treated successfully and discharged. And our PPE pipeline is flowing. We also have ordered 3 large decontamination systems to deploy across the Commonwealth as needed that can clean masks. We'll keep working to buy PPE and to help businesses figure out how to manufacture it. So we need to keep doing what we're doing, and we need to plan for that next phase. Our metrics for phase 1 are very clear. We need to see the percentage of positive tests and the number of hospitalizations both track downward over 14 days. We need to be sure we have enough capacity in our hospital beds and in our intensive care units. And we need to sustain our PPE supply. We will get back to work by greatly increasing our testing, then tracing the contacts of people who test positive and isolating these individuals, not everyone in Virginia. That is the key to moving forward. I'm going to step aside for just a moment and let Dr. Karen Remley explain